Hello and Assalamu alaikum to everyone. Welcome to our webinar today that we are celebrating as we all celebrate our International Women's Day today here at AKU. Welcome to my panelists. We have some very esteemed people joining us today from all over the globe. So I'm going to try to speak as less as possible, and we will have so that we have enough time to hear from each of our panelists, and then also give us time at the end to hear from all of you. So today's theme, and we thought long and hard about it, is about the specific challenges that women have had faced by the pandemic, but specifically in the area of higher education. We will examine the impact to date of the pandemic on women working in higher education. We will also spend some time thinking about how this pandemic has created opportunities for higher education institutions to take a fresh look at gender equity as an integral component of workplaces rooted in diversity. We're hoping that we will have some time to reflect on how gender equity can be integrated into institutional processes and design, and as an essential step towards excellence. Before I talk a little bit and introduce my panelists a little bit more, I wanted to share a sort of view and factoid with you all that 70% of our healthcare workers are women all over the world, globally. But WHO just recently published a report which sort of titles that healthcare delivered by women, led by men. And the conversation that we're going to have today is going to be around that what are the general challenges, but also specifically, have we moved back? Have we stepped back since the pandemic has come up, or perhaps not? So we're going to start with a little bit of a general question, and we're going to start with Professor Tazeen Jafar. The question is, and I'm going to let me sort of introduce Dr. Tazeen Jafar as well. And I'm going to, all of our panelists are so phenomenal that I want to take time to introduce them so that you remember what each of them does with their specific focus and what kind of leadership they have already exhibited in their own respective fields. So a little bit about Dr. Jafar. Dr. Jafar, as Luki has already spoken about, is our very star alumnus from the class of 1990. She's a professor of health services and systems research program at Duke and NUS Medical School. She's a research professor at Duke Global Health Institute at Duke University, USA. Visiting consultant renal medicine in Singapore General Hospital. She's also a visiting professor at the Al Khan University. And really is a well-known, renowned global health leader and expert with a focus on implementation research in hypertension, cardiovascular disease, and chronic kidney disease. She's a recipient of many awards. Dr. Jafar, we'll start with you. If you can tell us a little bit about, you've also recently published a study about this, and we'd like you to share a little bit about your work, the evidence that you found, but also some of what you've seen of how has COVID-19 impacted women and how have they responded.
Thank you so much, Ayesha. First of all, thank you so much for inviting me. It's a pleasure to be here, delighted to be here, and congratulations on hosting such an important forum and a platform for discussion with the esteemed colleagues here. Just starting with regarding the study that you are referring to, we conducted a meta-analysis of 68 studies looking at psychological illness during the pandemic, and these studies spanned from December to July 2019 to July 2020, so during the pandemic area. They were conducted in 19 countries representing the 6 WHO regions. And what we found was very alarming, that 1 in 3 persons were depressed or anxious, and women, in fact, were 50% more likely to be depressed than men. This finding was uniform across all countries. And I'm going to come back to this point again later in my in the discussion, that why are women, again, so affected, especially during the pandemic times, with depression and mood disorders. and what impact it's having on women. This findings from the study were published in PLOS One. The lead author, I have to say, because this is a forum for women equity, is my PhD postdoc student, postdoc Yeli Wang. The second author is also a woman. She's an MD PhD student from Duke and US, and I'm the senior author of the study. This was widely featured across media. We had in the Channel News Asia, World Economic Forum, and there's going to be a story on the BBC on this as well. And mainly on how COVID-19 is impacting the world and mental health, and particularly women. And as it's really goes back to women already having a lower social status compared to men, and now, added stress. And COVID, as you know, has turned the world upside down with the lockdown of the institutional places and now workplaces, and all the work has shifted to the home. And so now working women are doubly impacted by their own work, as well as the home chores, homeschooling, taking care of elderly parents, cooking, excessive cleaning protocols. So this is obviously putting a lot of pressure on women. And they are, unfortunately, all this work is not recognized. Women are less recognized for their work at home and in the office. There's a gender pay gap. So there is that. There are different career ladders. Women have to working women and who work in office have to work 2 to 3 times as hard to get the same level of recognition. There are a lot of frustrations, a lot of inequities. And so this is all a buildup of that, which is just manifesting itself in excessive amount of depression and anxiety, and is having really terrible consequences. And I look forward to having further discussion today on solutions and then implementing those solutions.
Thank you so much, Dr. Jafar. And you spoke about the gender payback and pay gap, and I was, looking at some of the sort of statistics on that, and it seems that the overall global gender pay gaps, especially at least in health, is about 16%. But as you go up to leadership positions, that gender pay gap actually becomes larger, and all the way up to 28%, which I think is quite alarming. And that is, I've been reading about this, that one of the big reasons why women are choosing to then leave the workforce, because they feel that their male counterparts, their spouses, their partners are probably earning more, so they may be the right people to leave and come back home as they help as the help is needed at home. Dr. Janjuha-Jivraj, thank you so much for joining us today. You have been a most wonderful find for us as we put together this webinar. So for all of you who are listening to us, Dr. Janjuha-Jivraj is an award-winning Forbes contributor and author of 2 books, Championing Women and Succession at Asian Family Firms. I'm really looking forward to now reading your books, especially the one on championing women, because it really does give a very practical guide on how, that is a sort of a very practical step towards making sure that we raise women in the area of leadership, how we champion them, and how both men and women can actually take up that role. Dr. Shaheena will be taking up the role of Associate Professor at HEC Paris in Doha starting April. She has had faculty positions at Henley Business School, University of Reading, and Brunei Business School. In both institutions, she established the Entrepreneurial Teaching and Research Centers. Shaheena, over the past decade, you've been working at board and C-suite level and across senior leadership to develop a lot of innovative approaches to promote effective cultures and ways of working across teams and organizations, really focused on gender and inclusivity. So since you have so much experience advising organizations in this area of diversity in leadership, what have you seen in terms of an impact at an organizational level with COVID-19?
Thank you, Ayesha. And just to echo Tazeen's comments, it's such a pleasure to be on this panel and to really be part of this conversation. So it's a pleasure to be here, and also looking forward to hearing participants' comments later on in the session. So I think we know, and Tazeen started to, her research is so important in talking about the impact of COVID, but what we do know, and often COVID's been described as being in a storm at sea, and we often hear the analogy that it depends what boat you're in. And I think every piece of data that's coming out now really shows that by and large, women have been in the most vulnerable, shaky rowing boats during the COVID pandemic. And we look at this from every perspective. We can understand it from a work perspective in terms of how they're coping with work. You've talked about the domestic burden, and research is showing just in the UK alone, women have taken on an extra 15 hours a week of unpaid domestic work. And I would guess, and I haven't got the data on this, but I think in other countries that's going to be substantially greater. And we know that while there is flexibility in working, and we've gone through remote working, there is still enormous pressure on women to deliver roles that they need to while juggling domestic roles. And you know, we're starting to see the impact, at least in terms of mental health. I think it's been interesting actually over the last year, because I'm seeing two extremes with organizations. And when I talk about organizations, these are corporates, these are universities, business schools, but also the public sector. I've been working with the UK government in this area, and also the health service. And there are two extremes. And at the first, we have so many constructive conversations kicking in. Organizations that are really keen to move much further around building inclusive cultures, and it has become a burning platform. And it's a couple of things. It's obviously as a result of COVID, we're having to deal with the risk of attrition with women. Other issues, particularly the Black Lives Matter issue, has also created that stimulus. So we're seeing action actually happening faster, far more open conversations, which don't just stop at chats, but actually moving further into action. And really recognizing the threat of the attrition of women. Of course, at the other end, we have what I like to call the ostriches. And these are the companies who frankly really do still have their heads in the sand, and are, at best, they've paid lip service to diversity, but for a lot of them, it's just, if we just humor the women, this will pass and people will get bored and move on to the next thing. And actually, what's really interesting about this whole area, diversity is so heavily linked to innovation, and there's enough research that shows companies that are diverse have superior performance in terms of innovation. And if there's one thing we've learned from this COVID situation, the only way companies will recover from this is by being innovative. So the companies that have really invested in diversity in their DNA of their culture, of their organizations, they are the ones that are already performing better. And I think we'll actually see that stretch between companies or organizations extend as we particularly carry through this year and start to cope with coming out of that initial storm of COVID.
Great. Thank you, Shaheena. And Dr. Elsbeth Dixon, wonderful, wonderful to have you with us at the AKU platform today. Elsbeth's a very special person. She heads the African operations for Common Purpose. She's the CEO of Common Purpose South Africa, which is, for those who don't know, Common Purpose is one of the leading leadership organizations, NGOs across the world, working, at least from what I last knew, in 19 countries. In addition to the South African operation, Elsbeth has a very interesting background. She got her master's and her PhD in applied mathematics at Cambridge University, UK, and then returned to South Africa, began working at the Council for Scientific and Industrial Research, where she held different roles. Then she led the Technology Top 100 award programs for several years for AdCorp. She also became co-founder of the Da Vinci Institute, which is a private university specializing in customized and postgraduate management and leadership education. And then at that time got a degree in psychology as well. So Elsbeth, we would love to hear from you at some point during this, how you've had your feet, sort of a foot in academia and higher education, and then also sort of in the entrepreneurial space, and how you juggle those two, and how you decided to kind of then move to one area, but still remain sort of aligned with some of the work that happens in academia through the leadership programs that you run. But for now, if you could talk a little bit from the South African perspective, and how COVID has impacted women. We're interested in hearing a little bit more about domestic violence. We'd heard about the ban on alcohol in South Africa when COVID happened. So are there specific challenges that you see? And then do they also run over into leadership roles and in terms of how women might be engaging with their teams? So over to you.
Thank you. It does help to unmute. Those are the most said words of 2020-21. Please would you unmute? I was echoing the thanks of fellow panelists for the opportunity, Ayesha. Wonderful to be here with you all this afternoon. And Common Purpose is an organization that I think specializes in the art of conversation. So delighted to be part of this conversation with yourselves and with the guests who are on the call, hopefully a little later. Ayesha, just touching on the very first point you made around the different roles that I've had during my career, at the heart of Common Purpose's approach to leadership is the thought, the observation of society, that the challenges in society cross boundaries and leaders usually don't. So I've certainly personally attempted to embody the crossing of boundaries in many ways, career-wise, and I think this is an enormously valuable thing and very pertinent to our current conversation, and what you've said earlier, Shaheena, around diversity and its importance and value at this point. So we'll perhaps come back to that. But your question around South Africa and the pandemic, and particularly the point around violence, you've heard, I work in the field of leadership development, and we work with leaders in business, in government, in civil society. We don't equate leadership with positional power or authority. And so I work with folk in every walk of life, in all stations. And so my observations come from that pool of women across the country and indeed across the continent. And it seems to me that the burden is fourfold. We can describe it in many ways, but the economic burden is palpable. In South Africa, we've shed over 1 million jobs. Only half of them have come back. The jobs that have been shed are in the sectors that are mostly populated by women, in health, as we know, in hospitality, in the South African context, domestic work, folk who are hired as domestic workers. So there's a huge economic burden that women have carried. The second burden, I would say, I call it the hours burden, very practical. We heard the statistic earlier, the 15 extra hours, the balancing of, the work and home just crashing in together into one potpourri. And that's an incredible burden that women are carrying at this point. The third one for me is the emotional burden. So many women are carers of others, not formally so, but they're looking after parents, they're caregivers of children at home, they're doing homeschooling and supporting so many other folk emotionally. So I think there's that enormous burden. And then there's the violence piece, gender-based violence, which we know has escalated. Some recent research I was looking at shows that domestic violence always increases in times of crises, whether it's a flood, whether it's an earthquake or whatever it is. The gender-based violence increases in time of crisis. In South Africa, we've got a triple challenge. We're a country with high levels of crime, high levels of abuse of alcohol, and high levels of domestic violence. 85% of the cases in trauma wards in South Africa are related to alcohol. And we went into a very hard lockdown at the beginning of the pandemic. We had level 5 and level 4, it was called for 2 months. There was a 70% decrease in reported gender-based violence during that period. 70% decrease when alcohol was banned for that period. So it's absolutely astonishing statistic. On the 1st of June, we went to the next level of lockdown. Alcohol sales were available again. Within 3 weeks, the president had declared gender-based violence to be the second pandemic in South Africa. The just incredible escalation. So we've definitely seen this incontrovertible proof of this link between alcohol and gender-based violence in the country. And of course, alcohol plays an important role in the economy, 3% of gross domestic product. So how government is going to handle that challenge going forward? Palpable evidence that alcohol is so negative in its contribution to trauma, and yet the jobs it creates, etc., etc. So there's a very interesting one that will play out there that will affect women acutely.
Very interesting. Very interesting. And you talked about, all three of you have spoken about sort of the emotional burden and, women leaving, and we've talked about that. There's also that idea of moral injury that has come about as, women have been working, especially in health. I've heard a lot of stories from nurses, from sort of frontline workers, that this is not how they thought they wanted to deliver health, or they've seen systems kind of break down, or they've seen things happening in terms of, inequity of how, whatever resources that are available are being doled out to either patients or healthcare workers. And I want you to talk a little bit about that. Perhaps, Tazeen, you can talk about it from the health perspective, in terms of, do you feel that, women have felt that more, the idea of moral injury, or it's not that sort of gender specific, it's across genders, and just because of the situation and the context that women find them, they're leaving, healthcare more. So perhaps a little bit, and then we'll go to Shaheena for some of this idea as well.
Yeah, I think that's a great question, Ayesha, and also your great question about whether is it really a gender specific question, or does it affect both men and women? And I think they're both intertwined. I'm going to start for a minute. I'm also first going to talk about women in academia, then if you let me. So sure. I concur. I think, based on the findings from our study, where we are showing very high rates of depression, particularly in women and mood disorders, it's not surprised that the moral injury is clearly playing a big role in people reconsidering their jobs, whether they're furloughing or they're just taking a break. I'm going to come back, or I'm just going to leave permanently. Who knows? We are still in a pandemic. We'll see how things evolve over time. For women in academia, there's a study done by the Harvard Business School, which has clearly shown that there's been a dip in the number of hours that people are spending, people who are working remotely, not just people who are working on the front line, but people who are, and the bench research especially. And this is for everybody, for both men and women, the numbers have gone down, but they have especially gone down for women. So 17% more, there is a disparity there already. So women are affected more. And so again, it comes back to the things that we've already talked about, that there is spending more time in the domestic chores. And this is evident, especially for women who have children younger than 5 years of age. So clearly the childcare is coming out very prominently here for women. And, they're junior faculty, they need to produce papers, they need to publish to get to the next stage. So I think the impact of this we will see in the time to come, because you need for promotions, for getting grants, if you're not going to be productive at this stage, and men are still doing this, right? And women are not able to do this. Right. So this is unfortunate. You raised a point in your earlier thing about the gap, the pay gap for the senior level faculty and the women in leadership. Unfortunately, it is true. It's not only the pay gaps. Women are held to a higher performance standard than men. That's the world we live in the male-dominated world. And so there are failures right now. There are crises right now. And somehow women are just accept failures, or they're blamed more. And so there is that pressure on women. So in academia, at the leadership levels, it's just not a good situation for women, unfortunately. And this is despite the SDG saying bring parity, right? So we are working towards that goal, and this is just taking us several steps backward, which is very unfortunate. For women who are working, and especially it's heartbreaking, because this is a pandemic, right? Your frontline workers, the thing that you started with, that our industry, you said 70% women are in the healthcare work. And so our nurses, our female physicians, many of whom have been redeployed, right? Are working and so men are also working, sure, and clearly, so whoever is doing this have been in close contact, but it's mostly women. A lot of them are women, and they're in close contact with the patients, and there's a lot of, and the COVID is very different from the usual kind of illness, because of the ethical dilemmas, because of the suffering. The families are not able to come to the units. The nurses also have to hold hands. They have to do extended hours. They have to wear the N95. They're bruising their faces. It's just, the taking out their suits. It's just, holding their, they can't run to the bathroom as frequently as they'd like to. It's hard. It's incredibly hard. And then the risk of, I'm going to go home. I may infect my family members. Some of them have to sleep there. It's a different kind of, it's just terrible, right? Then there was PPE shortage. Yeah. So they had to take an additional risk that they've never taken before, right? And across the globe, they had to do this. So these things are not unique to women, but women had to do this on top of the pay disparity. Women had to do this in a world where they are exposed to more abuse, right? Sometimes overtly and sometimes there's implied, and whether there are no career ladders, there is very limited recognition. So they are, for demoralized, and now you're imposing all of this. So yeah, so there is going to be more, and there are more of them. So there is a lot of moral injury. Unfortunately, there is a lot of depression, and it is obvious now because there are a lot of studies now coming out and saying, yes, it is going to be, it is more in women, more in health. A lot of it is nurses. We've seen it. I've seen it all around me. Everybody's seen it. There's a lot of depression. Some of it is very overt, and some of it is you do the screening and you'll see it. And right. I'm not surprised that women do not want to, some of them may not want to return to work, and we have to support. And so we need solutions. We need to empower women, create support groups. And there are places which have done that. And those places are doing actually very good. And so workplace safety, elimination of gender bias, and I hope that we're going to talk more about these. So, and how do we take care of our women workforce?
Absolutely. So, Shaheena, before we move into sort of a little bit sort of more optimistic kind of, design to this webinar and talk about opportunities, I'd like you to briefly comment on this as well from your perspective. I know that you've been advising the NHS in the UK during COVID-19, but have you seen this phenomenon of women leaving their workforce or facing a sort of moral injury or even otherwise in other sectors other than health, in the corporate sector, for example?
Yeah, so there is research coming out now to show that the risk of women leaving the workplace is quite high. I think data last week showed that, for example, in France, the number of women who have reduced their working hours are less likely to return to work once this situation stops, and whatever return to work looks like. And we're seeing that, and I think the one thing that's bothering me, and I want to come at this from a slightly different angle, we need to be very, very careful about the narrative, because the discussions I'm hearing, particularly with senior leaders in quite safe environments, is, well, if we're going to go backwards, then it's going to be hard to make up the progress we've made, for example, over the last decade. And when you talk about moral injury and you think about it, this is the impact of something being done to people who feel powerless and therefore choose to opt out because, all the pressures Tazeen said just make it very, very difficult. If we step back and look at this, what do we need to do? We need to find ways to keep that pipeline of women in leadership and strengthen it. And again, one of the things I think we need to be very careful about, when I first started working in this space about 10 years ago, in the UK, the narrative around women in leadership was, let's fix the women. And it was literally air quotes, fixing the women, inject them with confidence, get them onto these programs, and hey, they'll deliver. And of course, it didn't happen because there are institutional barriers that really need to be navigated. And the risk is we'll go back to that sense of thinking, let's sort out the women, let's sort out their domestic responsibilities, and let's put all the onus on women to sort themselves out, rather than taking responsibility as to what needs to happen within organizations. So if we acknowledge that actually that leadership pipeline is absolutely critical, the gender pay gap is such an important piece of this. And there are things such as ensuring reporting happens. It was suspended in the UK last year, and that has a huge detrimental impact on holding for accountability. But we are seeing, for example, you mentioned the work I've done with the NHS. The one thing that blew me away, every single one of our courses ran, despite the NHS being under pressure. The middle managers were still being trained. They were coming for their MAs, their MBA programs, 50% female, and they were even more committed because they knew what this meant, not just for the NHS as an organization, but for their careers. So I will later on talk about some very practical things that women can do. But the other piece to this, when you ask me about women leaving, I also want to just, again, shift any misperceptions we may have that when women leave the workplace, it's because they can't cope or they're going to stay at home and carry on their domestic work. We actually know, and I'm sure Elsbeth can talk to this a lot, there is a very, very high chance women will become entrepreneurs. And the rate of growth for female entrepreneurs has consistently been higher than the rate of growth for male entrepreneurs. And that's a really important point, because what we're seeing, entrepreneurship creates an opportunity for women to maintain and build economic independence, often socially driven businesses, which again, I'm sure Elsbeth will talk to, but giving them some degree of flexibility that they're not having in the workplace. So again, we need to challenge assumptions that women are leaving the workplace because they can't cope and therefore will be at home, they'll actually find other avenues to be economically and financially independent. And actually, I just wanted to share, this was a very personal experience for me. For 9 years as an academic, I went very part-time. I was probably one of the few academics who was working 1 day a week. But in that time, I actually set up a business, and my co-founder is on the group, which is fantastic to see her there. But we set up a business which basically allowed us to deliver diversity and leadership training globally. But it also allowed me to cope with having 3 young children. And one really important thing, manage domestic responsibilities with my husband, because he had to take an equal share in this. But it gave a lot of exposure and experience to actually changing the narrative and building in flexibility. So I think we just need to widen the way we're thinking about what it means when we talk about women leaving the workplace.
And that's very interesting, because I've been thinking about that, you know, as we're going to come to the idea of how institutions can respond to this, perhaps is there a space to give women in academia sort of more space to go part-time, sort of more avenues and more flexible sort of, you know, appointments in some ways where they can go and start their own businesses or start their own work as well, and sort of keep a foot in academia, because that seems to be something that works well for women, or that might be sort of one of the ways that they can manage, you know, their careers, which would be interesting then to sort of talk about from Tazeen's point of view, where she's talked about, you know, how there's only one career path in terms of academic promotions, that you've got to publish, and you've got to publish these many, and you've got to go to the right sort of conferences, and you've got to travel. So then how does that work out? Elsbeth, we'd like to now move this, and I know that, you know, common purpose comes from this narrative of optimism and hope, and let's talk to each other across boundaries and, you know, across cultures. So you're the right person to now sort of change this, the tone of this webinar, and talk to us a little bit about the opportunities that you feel COVID-19 can present to women in leadership, and what are some of your ideas of how women can maybe even capitalize on this situation?
Absolutely. Shaheena, earlier you talked about the schizophrenia in this situation, you know, the really significant positives that are there, as well as the really difficult aspects of it. And so that's very real in our engagement with leaders at this point in time. And I think that the phrase, let's build back better, has so stuck with me. I can't even remember which leader it was that shared that with me, that the pandemic offers us an opportunity to build back better. And there are very clear ways, I think, that folk are seeing how we can build back better. You know, the way that we operate, our traditional ways of thinking about work can be different and better. And I think it's how we work as well as what we do. And I'll touch on both of those. So in the how we work, there is so much more. People have become so accustomed to flexibility in this time. We've had to flex in so many ways. And so this morning I was talking to a bunch of our alumni from West Africa, Nigeria in particular, and prior to the pandemic, there wasn't a thought that you could work from home. It was just a taboo concept, because that would kill productivity, people wouldn't work properly from home and so on. And now everybody's worked from home, and now the country's got used to the idea. So the notion that we can work flexibly, that we can work from home, that productivity even maybe goes up when you work from home, these ideas have started to take root. A number of women leaders have expressed to me the extreme relief they feel that they're not traveling as much as they used to as part of their jobs. In the month of March last year, just before we went into the current mode of operation, I was due to fly to London twice and to Lagos once in the month of March alone. One of those trips was going to be for 12 hours on a plane to London and back. Now, I have to say that when the announcement was made that we were going into this mode, I felt relief. I felt extreme relief. I thought the madness is over, thank God. That was my thought. And so for many folk, you know, liberation, many women, liberation from that lifestyle, which didn't suit them, but was very much part of the package of leadership, has been quite significant. So flexibility to do it differently, to build back better. Talking to leaders from a significant corporate in the UK environment the other day, the women talking about not having to travel down to London for 2 days a week anymore, being able to do it from home. What a difference that makes when you've got little people at home. And, you know, it was one of the hurdles to taking on the job. toxic male habits in the workplace, and if I may label consumption of alcohol, the after hours consumption of alcohol in order to be part of the company culture, going on those trips together, the golfing thing, all of those things have become, companies have begun to realize they can actually do without them. The company doesn't fall over when you can't do that together. And so women are now speaking out. I heard a woman speak earlier this week about the fact that when she was being recruited for the company, she didn't speak about the fact that she doesn't consume alcohol. She realized it was a big part of the company culture. She chose not to say in the interview that she doesn't consume alcohol because she feared it would influence her chances of getting the job. So these toxic habits that have evolved in companies, I think we've seen how we can do without them. We can build back better without them. So it's flexibility in the workplace. I think another thing that we've realized is that empathy has a massive role to play. You know, empathy often was regarded as a weak characteristic. And so now we've seen just how fundamentally important empathy can be, and it's seen now as a sign of strength. This Forbes study at the end of last year about how well women leaders have done during the pandemic lists empathy and some of the other qualities like compassion as being fundamental to how well women leaders have done. The well-known ones, Jacinda Ardern, Angela Merkel, etc., etc. So there's that. There's the kind of work that we do as well that's changing, and you've just already, Shaheena, hinted at that there's a lot of new stuff emerging. This morning again, young women alumni from Zambia and Zimbabwe talking about going into e-commerce, going into technology-mediated education. So the world of technology that we have all been forced into in such an obvious way is really creating new business opportunities that are much more flexible than traditional careers, and young women are absolutely embracing them to do wonderful new things. I think I just want to add one little caveat to the story, and that is that INSEAD did a survey of its alumni in the latter half of last year about how COVID had affected them. And the one thing that they name is, while women have worked so hard to break through ceilings and glass roofs and all manner of such impediments in the workplace, we haven't had the concomitant approach of men to break through the ceilings at the home. And until we have real transformation in our homes of the role that men play in homes, it's very, very hard for women to sustain the breakthroughs in the workplace. And so I think as we build back better, I, as a mother of two sons, need to be thinking super carefully about what I have taught my sons around their role in the home. And until we get that piece right, I think there is a limit to how we can build back better and differently.
Wonderful. And this, just this last point, Elsbeth, makes me think of my fellow in child adolescent psychiatry. He's actually graduated, so he's now my colleague. And the other day he comes to me and he says that, Dr. Ayesha, you know, whenever we ask women, do you work, you don't, they will respond, I'm a working mother. So I want to start a movement, a hashtag of working father, right? So because we do not embrace this idea of fatherhood like mothers will embrace it, and you know, that will bring that kind of pride that, you know, I'm a working father. So there is that very important aspect of me that's beyond what I do for my work and beyond what I make, you know, at the end of the month and what car I drive, but I'm also a working father. So yeah, so you know, it just reminded me when you were talking about that. So we're going to spend the last sort of 5 to 7 minutes hearing from the three of you really about, you know, how can institutions respond to COVID-19 and use it as an opportunity, higher ed institutions, other institutions, to take a fresh look at how, you know, we can institutionalize this into the actual design of the workplace, and not just looking at you know, sort of professionals, but also support service staff and all of the people that work in corporations and institutions in higher ed educations. And then also, you know, we have heard all of these sort of arguments for integrating diversity into the university ethos, but what really is the most compelling argument that is going to get us there? Is it the financial argument, which of course gets everybody's ears up and they're like, yeah, this makes more money, so we need to do this for financial reasons. But is there a moral argument? Is there an ethical, cultural argument around sort of integrating diversity into the university ethos, because, you know, the world has been disrupted, so might as well now kind of use this opportunity to change this. So maybe Shaheena, you can start, and then Elsbeth and Tazeen, and then we'll wrap up and we'll go over to questions. Our audience have started asking questions, good questions.
Sure, thanks, Ayesha. So I think, again, just one thing we need to think about, and I love what Elsbeth said about building back better. My favorite phrase has been, we need to prepare for the next normal, because I think there is this sense that we fix ourselves now, organizations, universities fix themselves and we'll be okay for the next X years. But there are two things that we still need to remember. We always have the rise of automation, and even if we think within universities, the impact of automation will have a huge impact on some of our support services, maybe not so much the teaching, but a lot of other roles, and a lot of roles predominantly held by women. Number two, we will have more pandemics. We know that's likely to happen. So we need to get used to change. And so when you ask about how do organizations need to prepare better, there's a big point here about academic institutions, organizations in general, but academic institutions having experienced what we call exogenous shocks. These are deep shocks to the whole fabric of the organization, and having to respond. And we know academic institutions are not always as quick in responding as they could be. But what we are seeing, and this is something I was very involved with at Henley last year as their Director of Diversity for the Business School, we're getting a lot of pressure from students looking for transparency and accountability around what we're doing in the diversity space. We've had students asking questions, not just about the breakdown of faculty, but actually what are we using in terms of gender diversity for our case material, for our textbooks? How diverse are our authors? And that actually starts to really put a different lens on how students are making choices around universities and decisions. The other bit I just wanted to share, a couple of practical things. When we think about female academics, we need to also just recognize that there are some opportunities that have come out of the situation. This event, I don't know, I mean, Elsbeth was talking about her travel schedule last year. I had a similar one. I don't know if we could have done this in the real world. I mean, what you've got from the UK to South Africa to Pakistan, and participants from all over the world. And we're seeing much more virtual networking. And actually in academia, we're seeing much more research-based networking, which really opens up opportunities. The other thing I would say, it's also just about within the academic space, at least for academics, you can protect some of your time. We've had the comments, and Tazeen's absolutely spot on about the research challenge. But you know, there is something about, even if you consciously try to protect some of that time, that can be done. Because if you don't, you'll be pulled into all the pastoral care that usually is associated with female academics. But the one thing I would say in any organization, whether we're talking about universities, corporate, government, wherever, because we don't have solutions, because it's such an unprecedented situation, we don't have a cut and paste solution piece. So leaders are looking for new solution drivers, and they're looking for people who think differently, and women can do that. And actually it's about putting yourself forward, and if you're not comfortable doing it, getting your allies, your networks, your friends, advocates to push you into that space. So I'm really advocating for being bold and taking bold steps in this as well.
Wonderful. Elsbeth, what are some of your thoughts about?
A favorite topic, this one. Common Purpose has also at the heart of its approach to leadership development the notion that diversity is an enormously valuable attribute in society. And there's so many studies that are appearing in business journals now that show that the business outcomes in organizations that have inclusive leadership are so much better, 8 times better business outcomes. You know, it's increases in innovation, it's increases in resilience, all of those much valued, increases in agility in those organizations. So I think we need to think of ourselves as we build back better as creators in these institutions, and the notion that we can embrace diversity. You know, I come from South Africa, the country with the apartheid past, the country in which diversity was incredibly badly managed. The paradigm we need to move to is that diversity is an asset that we need to figure out how to unleash in institutions, not to manage it and mitigate it, but to really allow its full value. And women must play an enormous role in that. Obviously, there's multiple dimensions of diversity in society, but as 50% of the population, if not more, you know, this is an incredibly valuable voice that universities need to recognize, not as a moral imperative to include women, although it is, but as an incredibly huge opportunity that is as yet untapped to its fullest. So I think that's where the possibility lies.
Wonderful. Tazeen, do you, and as I was listening to Shaheena and Elsbeth, the thoughts that kept coming to me was that, do you think we can do this in academic medicine? Do you think we can do this for our, women in medicine and our nurses in medicine, use this time to relook at the leaky pipeline and the glass ceiling that is so prevalent in our space? Your thoughts?
So I think, Ayesha, that I think it's going to happen. It's going to happen. Some of it is going to be top down. Some of it is going to be bottom up. So it's inevitable in some ways, but it also has to be conscious. And I see globally it's happening, and the institutions that are actually the best, doing the best in gender equity, are the ones who bring women to the table, and more women to the table, and highlight their achievements. So then I think the funding agencies are now requiring this. So I sit on the MRC, the Medical Research Council, and the NIHR funding panel, funding boards. And they've just, and actually, I also have to say that the pandemic has been, there's been many negative things, but it also has given some opportunity to sit and rethink strategies. And one of the things that has happened here, that pretty much in all the grant proposals now, these funding agencies, also at the NIH, has had a discussion with Francis Collins. And so pretty much in all the newer initiatives, there is an entire section now on gender equity. Your proposal is going to go, whether it's for a program grant, whether it's for center grants, whatever, there is going to be an independent look with and all the sections. So in terms of the research content is what are the gender dimensions of the research that you're proposing? What is the research team? Is a woman leading? If not leading, it's okay. You've got brilliant men, they can lead. But how have you included women as a co-PI? Are you training somebody? Are they going to be first author, second author, last author? How is that going to play out? So there is a very close, where are the women in the managerial team and the admin side? So it's a pretty deep look. And then how are you going to report this? Are you going to do this granular again, so a lot of gender dimensions. And I think that, so the institutions that are going to be responsive and flexible are the ones who are going to get right. They're going to succeed. So it's inevitable, it's going to happen. And not only that, we are also asking, put it on your website, your policy. Right. So it's transparent. Right. Yeah. So you got to do it. And I think the smart institutions will do. AQ is a very progressive institution. You should do it very quickly. Okay. So, right.
We're on our way. We're absolutely on our way.
Absolutely. So that, then I think, other than that, I think, editorials, opportunities to write commentaries. There are lots of opportunities to rethink and say, gee, how can women from the South, and we need women from the South. There are lots of opportunities. We are looking. And the other, let me also add something here. I think, there is this notion about, quotas and, how do we do this? I'm going to give you a great example from Duke, where the provost, Sally Conworth, is a woman and a very progressive one. And she's hired 8 out of the 10 deans at Duke are women, right? Which is brilliant. And the thing was not based on quota. It is you go and you get the best person. So the thing is, how well are you going to, how are you going to do your search, right? And how extensive is going to be the search? And are you going to remove the biases? And if you remove the biases, there are outstanding women out there, right? So you're going to bring the women, and how are you going to retain them? So that's what we have to think. I think there are brilliant women out there, but the thing is, you've got to change your institutional culture. You've got to invest in that. And you got to think, when we bring somebody, how are you going to retain them? If they go out for a bit, that's fine. How are you going to bring them back? So those things, and how are we going to support them? Leadership training of women, ensuring a safe place, good policies, gender equity, pay equity. Again, I'm going to come back to that, and put it out there, make it transparent and be attractive. Go out and talk to women. And this is not about, let's be very clear. We are not talking about positive discrimination, right? We don't want, anybody substandard here. There are very highly qualified women, and train these and bring the younger ones and train them. That's what we are talking about, right? Because everybody wants your own unit to succeed, your organization to succeed, and those are the organizations that succeed. So that's what this is all about, right? So I think the message needs to be very loud and clear, and value your nurses, value the people that you bring, because they are really outstanding, right? So make them feel that way.
Excellent. All right. So thank you so much. And we're going to move to some of our, our audience questions. There's one question, an interesting one. I think it's a hypothetical one. Somebody's asking, there's so much discussion on sort of more mental health conditions amongst nursing and women in medicine. Has anyone considered looking at this from the intersectionality lens? That is, and the majority of countries, nursing is predominantly represented by women. It would be interesting to see if we had the same indicators in countries where nursing was dominated by men or medicine was dominated maybe by women. So it's an interesting hypothetical question. I don't know whether a place like that exists, but I'll put it out there. Anybody wants to respond to this? Any idea? Shaheena, you want to take this on? Do you have a sort of sense of, whether this might change?
Yeah, I'm trying to think of maybe similar industries where you have that frontline piece dominated by men, and maybe even then it's a little bit tricky, but I was thinking, for example, about hospitality. But I think, it's the problem we have is anybody who is working frontline is at risk in any sector. And this is obviously very much focused on the healthcare sector. And actually the point I made previously, we are not just dealing with the impact of COVID, but we're also dealing increasingly with the impact of automation and technology. And that is crunching the skills that are low skilled. And we need to think about how we reskill individuals so that they are able to protect and retain jobs. Obviously, within the UK, there was a big piece of work last year from an intersectionality perspective, looking at the overlap of frontline workers from ethnic minority backgrounds and the increased risk to COVID. And then, of course, you have that with the gender piece as well. And I think what was interesting from that perspective in this wider diversity piece was how it was handled, because there was a lot of there were issues about the way that material came out, how the government responded, but again, from an activist point of view, it was pushed, and there were lots of conversations. So I think perhaps what we do need to recognize is where you've got very vulnerable groups in the front line, it's not about remaining in a passive state of what's being done to them, but there's more activism being kicked off to actually enable people to find their voice and have the conversations, and then feed into everything both Elsbeth and Tazeen have said in terms of supporting.
Wonderful, wonderful. There's another interesting question. There was a question that I think we've already answered. The question was about pandemic being a watershed moment, and what kind of opportunities has this presented for women? And I think we've answered that. But the question is that on a podcast, Barack Obama once said that in the home, men empower their daughters to go out in the world to be anything and do anything and be a force of nature. However, in the boardroom, this same ethos doesn't apply. What are your thoughts about this? This phenomenon? And Elsbeth, maybe you can take this question, but I also kind of feel like, women just need, and we've talked about that, they need to go into the entrepreneurial space and be their own bosses to really make an impact. It seems that somehow corporations and institutions, because of the unconscious bias, really do not allow them that kind of space to kind of shine and get all the way to the boardroom. So, Elsbeth?
I think that it is a numbers game. Years ago, when I was still a scientist, the executive team comprised about 8 individuals, and then for the first time, a woman was appointed onto the executive team in this National Science Institute. And I remember talking to her about how difficult it was for her to bring her voice as the lone woman in that team. And she said, you need to get to a critical mass before the voice starts to be heard. We've done a lot of work here in the South African context with young folk who are mainly young folk of color coming into big institutions like banks. And then there's a huge pipeline of young graduates of color coming into the bank, but they don't reach the boardroom ever. It's a white boardroom, white male. And so, you know, the banker then asks itself, what's going on? Because we're pushing the pipeline, but nobody gets there. And it's the numbers game. It's the subtle culture of the boardroom and how difficult it is for outsiders to break into the subtle culture of the boardroom. And so I think as long as we keep working, keep raising awareness around subtle culture, which is coming out now through the pandemic conversations, that we didn't realize that the fact that we went to the pub in the evening or on Friday evening was such an exclusionary practice. It's a sort of a well-meant, fun practice. We didn't realize how exclusionary it was. Now folk are starting to have those conversations. So I think there's a lot of opportunity now for, off the back of this awareness, for folk to feel more included, and therefore for greater numbers and greater voices to start coming through into those boardroom environments. But the mechanisms of exclusion have been so subtle in many cases. So I think that's been the problem. It's not the overt exclusion, it's the implied and subtle exclusions that have been the real barrier that so many have come up against.
And, you know, this brings me to something that Tazeen had talked about, how a woman's, you know, she does not sort of make it, or if she does not sort of succeed at something, it's seen as a mark of her ability. But for a man, it's seen as part of the learning curve. So there are all of these, and these are all subtle unconscious biases that are out there. So nobody thinks about this overtly, but they're like, so should I send another patient to this female surgeon because I'm sure that she's just not that great a surgeon, versus a male surgeon, you know, yeah, you know, bad things happen, or you know, cases can go wrong. It's just part of you know, the business of, you know, the art of doing business. So yeah, so again, those subtle things. And they've talked about the critical mass being 30%, which is why I keep talking about you know, institutional design, intentional institutional design, that there will be 30% women in my C-suite, there will be 30% women in, you know, so that just kind of makes it a lot more overt. We have one question, and I think that's going to be our last one because we're almost out of time. And, you know, Tazeen, you've spoken a little bit about this, so maybe you can sort of add to it. This person's asking that all these effects of COVID are further enhanced for women in healthcare, particularly in palliative care and end-of-life care. I run a hospice in Toronto and have observed that many of the women want to either leave their jobs or take part-time positions, which are hard to get one because, with the employer policies during the pandemic. So any thoughts or comment in terms of policies that, you know, could change around in some of these areas like palliative care and end-of-life care, where women are feeling probably moral injury, burnout, and, you know, things like that?
Yeah, I mean, I think that clearly palliative care must be the tough one, right, during this time. Again, for the same reasons that, you know, it's palliative care is tough as it is. And then now you have massive numbers under a very short span of time, and some elderly, some very young ones, and you can't have families there, right? So the people who are taking care of them have to do everything. And that's very unfortunate. So these are, and sometimes, you know, entire number of family members coming back and forth, and you're trying to restrict, you know, somebody gets sick, then you've got to quarantine them. So you have to, so there is that aspect too. So there is a lot of burnout. So I think that in that circumstances, I also know that people who are working there, you really have to go back and look at your policies again, look at the gender pay gap. I'm going to say that again. And especially during COVID times, the people who are working, some of them were the private care institutions. I know in the US this was happening, and other places this was happening. I don't know about Canada and Toronto, but there was a huge need. And so now the people who are working in areas where they're going to obviously going to feel, gee, my counterpart working at X place is making so much, and I'm here slogging away, and, you know, and not underappreciated. So I think those are the things. And how can you make up for that? There are other ways to make up for it. So ensure that there are no gender gaps, no pay gaps, and ensure that there is a very supportive environment. So until I think that, and Ayesha, you can speak to that about the mental health counseling services. I would say, please be proactive about the mental health. Don't wait for somebody to come to you. I think counseling here in these situations for all the healthcare workers who are providing mental health services during the COVID times, I think that's really going to help. So that is separate from the leadership training and the career track. So ensure them, and I think that they're going to feel very, very supportive. So I think that is probably going to be something that I would say this is going to be a short-term solution, but probably is going to, as well as a long-term solution. But I think they're really going to feel that valued and is really going to help manage that burnout.
Right. Thank you, Tazeen. So it's what's interesting is I've been reading a very interesting Lancet editorial on, developing a strategic plan around mental health interventions, post-COVID. And, they've changed the paradigm. They're really talking about developing a framework for empathy and compassion. To your point, Elsbeth, as well, that they're looking at how can we train people in empathy and compassion as an answer to all of the mental health problems. So it's not just at the leadership level, at every level, I feel that something that we thought was sort of the soft skill has really shown and come out as the hard skill, as the skill that we all need to be trained in terms of, how we lead and then how we take care of our employees and our frontline workers and other folks.
Let me add something, Ayesha, to that, to your point, is that this year, Singapore has introduced a mental health curriculum to all secondary schools. They're going to train the students, the teachers, their parents, again, to address this. That's phenomenal. I think all countries need to be doing this. I think we're going to be watching how the acceptability and the outcomes emerge from that. But it is just a very beautiful program. So I got to say that, right?
Wonderful, wonderful. All right, so we're going to have to end. Thank you so much, all of you, for joining us today from Singapore, from South Africa, from London, we sitting here in Pakistan. This has really been lovely. Another, again, silver lining of COVID that we were able to bring together people from all across the globe, all of these wonderful women. Thank you very much. Appreciate your time. Thank you for our audience who was here. Thank you, Fatima, Luki, and all of you that made this webinar possible. And have a great evening, everyone.